Campaign 2020 is sponsored by Wisconsin Hospital Association, Quick Trip, Wisconsin Counties Association, Wisconsin Realtors Association, and Wisconsin Operating Engineers Local 139.
Kristin Lyerly of Pere is a Democratic candidate in the 88th Assembly District. Kristin, welcome to WisconsinEye.
Thank you so much for having me, Steve. I'm so excited to be here.
I'm intrigued by one of your campaign slogans. It is, let me get it right, you deserve the voice of medicine in Madison. Okay, what does that mean? Put context on that.
Don't we, though? So I'm a physician. I am not a politician. I have never run for an elected office before. But these are unprecedented times. So now more than ever, we need the voice of medicine, the voice of science, the voice of data to help lead us through this pandemic and find our way out. And we'll be stronger. I truly believe we'll be stronger than we were going into it, but we have to do it together.
Okay, now you've got, so is the pandemic the reason that you, with your family's blessing, decided to run?
Yes, yeah, it is. So when our legislature sent us to vote in the midst of the pandemic, in the early stages, when we didn't really understand it, and, information continues to evolve, but there was so much we didn't know back then. I live in Green Bay, so there are typically more than 30 polling places, and we were down to 2. My oldest son, who's 21, and he's also my campaign manager now, he and I went down to East High School, and we drove around and saw all those people standing in line in April, and it was gloomy and drizzly and cold, but they felt that it was important for them to be there, taking their life into their own hands so that they could exercise their obligation to vote. And we went home that night, and I started talking with people saying, what can I do? How can I help? Because things need to change here. And 3 weeks later, we filed our papers, and we haven't looked back. I have 4 sons, and my husband, Jim, it was essential that they were on board when we decided to do this. And they have all helped out with the campaign in one capacity or another. It's been a family affair, and we're having an incredible time. And we know we are going to make a difference up here and across Wisconsin.
That's interesting, but let's stay on the pandemic. You then, as a physician, you support Governor Evers, his order last week extending the face mask edict to November 21, correct?
Absolutely, I do. I'm a practicing obstetrician gynecologist. I am in clinic with vulnerable patients, women who are pregnant, women who are elderly. Families can't come in and share the experience of getting through their pregnancy together because we're having to limit the number of people who can come to clinic because, clinics are a hotspot, sick people come in. I'm working in the hospitals where I see every day we're still reprocessing the N95 masks because we don't have enough PPE to go around. It's a crisis. I'm very concerned about what's happening right now in Wisconsin. La Crosse is the number 1 hotspot in the country. Green Bay is number 6. Our hospitals are booming. Bellin Hospital is triaging people in the emergency department outside in the hallways over the weekend. Our case numbers continue to rise. Our percent positives, which is an indicator of how many undiagnosed cases are in the community, those percent positives are persistently in the 20s. I am very, very concerned that in the next couple of weeks, we are going to be in the midst of a serious crisis. And I'm hoping that the people of Wisconsin will continue to stand together and do simple things like wear masks and respect social distance, wash our hands, and just support each other.
Does this mean that hospitals in the next state budget should be an even greater priority than they might be in the current budget? Kristin?
They have to be. Hospitals and healthcare workers are taking the brunt of what's happening with the pandemic. Outside of the pandemic, I've done a great deal of work to support my colleagues in obstetrics across the state. So obstetrics, people deliver babies, whether they're OBGYNs or family medicine docs or midwives. There are lots of different people who do that. And we have a problem here in Wisconsin where our rural hospitals are profoundly underfunded and they're struggling to stay open. We've lost a lot of hospitals in vulnerable areas where they are desperately needed. So we need to ensure that we've got the providers and the funding and the information that we need to keep these hospitals open to continue to serve the people of Wisconsin.
If the pandemic meant that state government didn't collect, let me make up a number, $1 billion in taxes, your ideas on filling that shortfall, would you cut spending or would you raise taxes or fees?
That is such a hard question because there just isn't enough money to go around right now. We've seen these giant bills come from both our state legislature and from our federal legislature supporting people so that we can get through these difficult times. Hey, where does the money come from? Where do you even consider cutting? I mean, our schools are underfunded and have been. Our hospitals are underfunded. I don't even know where you could start with those cuts. But I do know that there is a substantial portion of our population that make over $400,000 that can't afford to pony up. So I would say no more tax increases for people who make less than $400,000, but people who make more than that, we can do better. This society serves us well, and it's time for us to step up and do more.
One more question on the pandemic. A bill introduced 3 weeks ago in the legislature said if you're an organization, a charity, a business, and you comply with COVID-19 protocols, you could not be sued. You could not face a COVID-19 lawsuit. Could you vote for that?
That's a tough one. Frivolous lawsuits are never a great thing. But on the other hand, you want to make sure that workers and people who serve in these capacities are protected. So I would really try to focus on just ensuring that we stand together and reduce our risk related to COVID and to the pandemic. It would have to be, I would have to understand the details a little bit better to be able to commit to that because the devil is always in the details. But again, the fundamental answer here, I think, is that we need to stand together.
We've all watched the debate over police reforming over the last 5 months. It's been national and, of course, in Kenosha. The speaker's going to form a task force. The governor has 9 bills. Senator Van Wanggaard has 7 or 8. The police union or association has its bills, and the Black Caucus has its bills. Here's my question. Are there any specific policing reforms you think should be enacted?
Yeah, this is another one that is such a firebrand. We're so divided on this. You're either a Blue Lives Matter person or a Black Lives Matter person, but that isn't really where we live in the real world. We live in the middle, where we've got to find those common sense solutions. There's no question. Police need more support. They need more training. And we also need to address systemic racism at its fundamental levels. This has been a problem for hundreds of years. And Kenosha, here it's home for us. So, yes, I really appreciate Governor Evers and his forward progressive thinking on these bills. And I absolutely support police reform. I despise the word defund the police because it just does not reflect what needs to happen here. I've said this probably 6 times already in the short time that we've been talking. We need to come together. We need to identify these problems and we need to solve them together.
As more states around Wisconsin legalize recreational and medical marijuana, what's your position, please?
Yeah, I am for legalization of recreational and medical marijuana. As a healthcare provider, I see the evidence and it's there. But also as a healthcare provider, I caution my patients and my friends that this is not the answer. It's not the panacea. We know that for pregnant women, no amount of marijuana or of alcohol is safe in pregnancy. So I feel a little torn about this one, but I also recognize the implication that being caught with even a small amount of marijuana has on our communities of color. So this is a complicated question, but truly the answer is legalization.
You support the governor's Fair Maps Commission that would draw the next congressional and legislative district lines, then forward them to the legislature to be enacted?
Yes, I do. We can't live with these gerrymandered lines anymore. It's foolish. Our voters should choose their legislators. The legislators don't get to choose the voters.
Wisconsin is a high property tax. That's why for more than 20 years, schools and local governments have been living with caps and limits on property taxes. If you're in the legislature voting on the next state budget, would you vote to continue those caps and limits on property tax levies?
I think when it comes to funding our schools, we have to fix the broken school funding formula. And that likely will involve having to remove those caps so that we can, as communities within our own communities, determine what the best things are, what the best way to approach that problem is. I always hate caps and mandates because as a physician, I like to sit in an exam room with my patient and talk about what is that specific problem and talk about all of the options for solving those problems, because there's rarely a one size fits all. So a cap or a mandate to me is a one size fits all solution. I'm about coming together and talking and listening and compromising.
Do local governments, specifically cities, villages, and towns, do they need new revenue options? And I'm referring to a bill by Democratic Rep. Evan Goyke in Milwaukee. If a referendum passed, Milwaukee could levy a half-cent sales tax. Do we need to give local governments revenue options like that to reduce their reliance on the property tax?
Yeah, I think so. We did that up here in Green Bay for Lambeau Field, and people were behind it because they recognized how important Lambeau Field and how important the Green Bay Packers are, not only for our mental health and for our love for this community, but the economy up here. Individual communities need to be able to have that ability to determine what is right for them.
Governor Evers last year proposed raising our gas tax 30.9 cents a gallon to stabilize our funding for highways and bridges. Could you vote to raise the gas tax?
When you look at all of the different things that go into supporting our transportation infrastructure, in the upper Midwest, Wisconsin really doesn't spend as much as Minnesota or Illinois. So our gas tax may be a little bit on the high side compared to our peers, but our registrations and other fees aren't there. So if not the gas tax, then something else. But I think we need to do a better job of funding our roads. What is it the governor always says? Fix the damn roads. I'm behind that.
If a school district or a local government plans a major public works project, should they have to give a preference to Wisconsin businesses?
Well, we know that Wisconsin workers are the best. We need to level the playing field. So we need to support our workers in Wisconsin and make sure that they have access to prevailing wage, that right to work is removed, that all of those Act 10 things that the Walker administration put in place a decade ago are just really are repealed, and that we are thoughtful about how we support our workforce, and that we are raising a strong, capable, well-educated workforce that can provide for their families. So that also includes, and I'll bring in healthcare. As a healthcare provider, I know that 42% of my patients, my pregnant patients, are on Badger Care. We need to ensure that everybody has access to quality, affordable healthcare. That too will ensure that small businesses are able to stay afloat, and we're able to encourage more entrepreneurs. So this is so much about the fabric of Wisconsin and all Wisconsin workers. And then as we come out of this pandemic, I've got this vision for something that's so like a New Deal. We're going to be struggling, and we've got infrastructure projects that are just waiting to happen. Up here in Green Bay, we've got a south bridge over the Fox River that we've been trying to build for ages. Let's get it built. This is the time to help put people back to work and to make sure that they have good, well-paying, safe jobs.
Last question, differences between you and the incumbent you're trying to beat on November 3rd?
So many differences. First of all, I have a plan for getting through this COVID pandemic, and my opponent has been very clear that he doesn't have a plan. I support our public schools, our teachers, our students. They have been suffering. Over 60% of the kids in the Green Bay School District are on free or reduced lunch. And I couldn't believe it when I first heard that statistic. I thought, how is it that we are succeeding as a society when in Green Bay, Wisconsin, kids can't even afford food? So supporting our public schools, recognizing the importance of clean water, making sure our farmers' mental health, economic health are being addressed. There are just so many different opportunities, but fundamentally they all come together. So you can't consider any one of these things in a bubble. Our economy affects everything. Our health affects everything. Our environment affects everything. We need leadership that is thoughtful, considerate, and capable of working well with others.
Kristin Lyerly of Pere is a Democratic candidate in the 88th Assembly District. The election is November 3. Thank you for talking to WisconsinEye.
Thank you so much for having me.
Take care. Thank you.
Campaign 2020 is sponsored by Wisconsin Hospital Association, Quick Trip, Wisconsin Counties Association, Wisconsin Realtors Association, and Wisconsin Operating Engineers Local 139.